Continuing here, our special coverage of the COVID-19 global pandemic here on the Exam Room Podcast, brought to you by the Physicians Committee with the weight loss champion, Chuck Carroll. Joined now all the way from Beijing, Dr. Jia Xu. Welcome back to the show, my friend.
Hi, Chuck.
Really appreciate you taking the time again. I know I was speaking to you just before we started rolling here that your last interview was so well received. There were so many people who were grateful to hear your voice. So really appreciate you taking the time again.
Oh, thank you. Thank everybody.
My first question to you is this. It's been about a week since we last spoke. How have things progressed? How are you doing?
I'm doing well, and life goes on, and people actually have started to return to work, but with masks. And but still, getting in and out of communities in Beijing is still very tightly controlled. You're supposed to show your ID, and if you do not belong to that community, probably you're not allowed to get in. So in and out, you will need to show your ID and get your temperatures checked. So I think that will continue for a while. Yeah.
So when you actually go and you try to get into these communities, they have somebody standing guard checking IDs and they will take your temperature right there, huh?
Yes. Yes.
Is that cause? I mean, just the old curiosity is getting me here. Does that cause any sort of traffic backup? Is there a major, influx of people trying to get into these communities?
No, no. I mean, I think most of the people trying to just return to their home. So and also the temperature taking is just 1 second. Very 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 convenient. They have this handheld thing that they point it to your skin and your temperature is read.
No. Okay. Well, that's not too bad at all.
Yeah.
When you say that people are going back to work, I guess I assume then that more and more businesses are reopening their doors. Then,
Yeah. Absolutely.
what does that mean as far as I know that you're in Beijing, so there's probably a lot of mass transit there. What does that mean in terms of people riding the subway, or as we call it here in DC, the metro? Are the trains getting more crowded again?
I personally haven't been to the metro for a while, so I don't know what it's like down there. But I would assume that will be probably less people, but still will be a lot of people. I see a lot of cars on the road, and it's like a pretty as busy as before. And but there's one thing that the shared bike, the shared bikes are not very much used like before.
Okay. Um, and what about the grocery stores and movie theaters and things like that? Are people going back out for entertainment?
No, not entertainment, but grocery stores are very they're open regularly, and I see people lining up for their groceries. Those are very regular, but movies are not open yet.
Not quite yet. All of the theaters around here are also closed down for the time being. I know that
Right.
this morning I was reading a report that the Chinese Basketball Association, which would be akin to the NBA here in the States, they were getting ready to reopen in the middle of April, but that now has been pushed back by another month. But perhaps, even with just one more month of everybody kind of trying to take care of themselves and continuing to prevent the spread of the virus, maybe then we can see even more normalcy return and start to see things like basketball games, sporting events, movie theaters start to reopen. Do you get the impression that everyone there is kind of ready for life to return back to normal?
Um, I think not quite. I think still the government's still very concerned, still very cautious. And although people are returning to work to get the regular economy going, but still there is a pressure for everybody to watch out for any secondary breakouts,
And what about
outbreaks.
yeah, I got you. What about down in Wuhan, where the epicenter of the coronavirus was? I understand that there have been some changes there, and people are actually free to leave the city.
Yeah, as of March 25th, they're free to leave their cities, but I think it depends on the receiving city to decide if they are allowed in or being quarantined or whatever.
That's still a pretty big update there. I mean, that's very significant. They had been in complete lockdown since this thing began, correct?
Right, that's right.
Okay.
Until March 25th. Yeah.
And what about international arrivals? How are flights coming into the country being handled now?
Right. International arrivals are very strictly diverted from large cities like Beijing, Shanghai, I think. But Beijing is definitely, and people are very strictly screened and quarantined because recently new additions diagnosed cases are mostly from international arrivals.
Yeah, we see on the news here and in reports that the number of new cases in China are just plummeting. As a matter of fact, I would need to double check this, but I'm fairly certain that the report out of China is that there are no new local cases of COVID-19. The only new cases that have been reported in recent days have, in fact, been from international arrivals. That sounds like what you're hearing as well.
Yes, I have the same impression. Yes.
Gotcha. Um, Speaking of international stuff, I know that there are some medical teams from China now that are being dispersed internationally to provide aid elsewhere. Is that the case?
Oh, yes. Factories are actually cranking up to make masks to meet domestic needs and also international aid demands. And I think they have sent medical teams from, some parts of the country to help some of the other countries that have been heavily affected, like Italy and Iran.
And let's talk about one of the big things here is making sure that our manufacturers are stepping up to the plate and producing medical masks and ventilators for what's expected to be an enormous crush of new patients with this virus. Are people there also really ratcheting up productions of these surgical masks, these N95 masks?
Yeah, yeah, yeah. It's still quite in demand. Yeah.
And what about vaccines? I mean, here's kind of the big question. What do you know about any vaccine trials that are being conducted over there? Here in the U.S., the big news last week was that there was, in fact, the first person to enter the human clinical trials with a potential vaccine. What's going on in China on that front?
I read several pieces of news related to this. I think in one piece of news, I think the first dose of the vaccine has been injected into humans in phase 1 clinical trial. But in another, I read that people are still doing the animal phase of experiments, and the human trial won't begin until the end of April.
Well, before I let you go, I mean, let's talk about you this past week. I mean, you're hearing all of these positive developments, people being allowed out of Wuhan. You're hearing about people returning back to work more and more. Are you feeling like, hey, there's light at the end of the tunnel here?
I personally don't think so. I think still we still have pressure of this virus coming back, and and also because we're so mobile a society. So I mean, it's hard to say because there's international travels and there's people who are cured, but still they are bearing the virus, and I don't know if these. I think the scientists don't know if the virus would come back from people who have already infected before. So I think it's still a constant battle and constant how can I say vigilance against this.
Let me put it to you this way then. Do you think that the worst is behind you at this point, where you are?
Yeah, I would say at least for now we are better than 1 month ago. Yeah, but still, yeah, I would say so. Yeah, we're better than 1 month ago, but still I would be very cautious looking forward.
Gotcha. Okay. Well, I greatly appreciate you taking the time. Real quick, the last time I spoke with you, you told me that you had just done a video conference in front of about 2,000 people talking about the benefits of a plant-based diet with athletes. What have you been up to on the work front over the past week since we last spoke?
Oh yeah, yeah. This past week has been very busy. I had almost one live streaming every day. So yeah, so well, some mostly is like a PPT presentations to I think yeah, there's one in one presentation I gave to about 40,000 people, and that was a big one.
So for the presentation in front of 40,000 people, what were you discussing?
Well, we talk about good nutrition. We talk about how inflammation would how can I say the information would affect our general health and also what happens in situations like the cough 19. This is pneumonia. So pneumonia is inflammation of the lung. And if you have some basic information already before you're contacted by this virus, then you'll have double inflammation. So then you have inflammation plus inflammation, then it will be much difficult to control. On the other hand, if you're on a good diet and you have good bacteria in your gut, and then you generate some short-chain fatty acids, which is anti-inflammatory, and this will be doing a lot of good. So I have looked into the literature, and there's even some articles about how these people who fared much better if they have how can I say good bacteria in their gut when they do the bone marrow graft when their innate immune system have been killed by the irradiation. And so I think it's fascinating to look into this data, and it's already there, and it tells us that if you are you have a good diet, like plant-based mostly, or completely vegan, then you will probably fare out much better than the other guys.
All right, Jia. Well, thank you so very much for your time, my friend, and bringing us the update, and you continue to stay safe.
Yeah, thank you.
If you like that interview and you want more of it, go ahead and subscribe to this YouTube channel. Leave a nice comment below. And for the full interview, also head over to Apple Podcast and subscribe to the Exam Room Podcast by the Physicians Committee. New episodes with information and inspiration each and every Wednesday.